ICH Q3D is the quality guideline from ICH for elemental impurities. I welcome all the viewers to this video for elemental impurities overview. There are various types of impurities like organic, inorganic, residual solvents, nitrosamines, which are required to be controlled to demonstrate the quality, purity, safety and efficacy of the pharmaceuticals. ICH Q3D guideline provides detailed information for elemental impurity compliance. And this Q3D guideline ensures the safety and quality of the pharmaceuticals. The risk assessment is required for controlling the elemental impurities. And as these elemental impurities are present in a low concentration, or you can say that these are controlled at very low concentration, so analytical techniques for estimation plays a great role in the elemental impurity analysis. So now we'll see the understanding for ICH Q3D. This guideline is the quality guideline from ICH, which focus on controlling the elemental impurities in the pharmaceuticals so that the safety and quality is assured. This guideline is very much important for complying the regulatory standards. This guideline provides the framework for assessment of the elemental impurities, and this guideline focus on the toxic elements like arsenic, cadmium, lead, mercury and many more. These are considered as the toxic elemental impurities, and the implementation of a risk-based approach is required. This guideline understanding is essential for compliance. Importance of controlling the elemental impurities. So, to ensure the patient safety by minimizing the toxicity risk, we need to have risk assessment control onto the elemental impurities. The understanding of elemental impurities and controlling of the elemental impurities prevents the regulatory non-compliance and the product recalls, and that's why it builds trust with regulatory authorities and healthcare professionals. We need to understand from where these elemental impurities can come, because if we need to control it, we need to know the sources. Sources may be from the raw materials, manufacturing equipments, packaging materials and the environment. Raw materials like APIs, excipients may contain the elemental impurities. Sometimes manufacturing equipment which are made up of different metals may come in contact and can introduce the elemental impurities. Packaging materials may be as a source. There may be some leaching or contamination, and environmental factors responsible may be like water, air and other contamination. The elemental impurities are toxic in nature, that's why these are required to be controlled. Common elemental impurities in the pharmaceuticals are heavy metals, which are like lead, mercury, cadmium, arsenic, many more. Process-related metals may come from the catalysts, reagents and other process-related metals, nickel, chromium and copper. Some may come from the leaching from the containers. Analytical techniques are required to be very sensitive for detection of the elemental impurities. So, mass spectroscopy, X-ray fluorescence spectroscopy, atomic absorption spectroscopy and HPLC with ICP-MS are used to detect the elemental impurities. There are some model analytical techniques like ICP-MS, XRF, AAS, HPLC, ICP-MS are used for the testing of elemental impurities. Challenges in the elemental impurity analysis. as these have very stringent limits. So challenges are like detection of ultra low concentrations, matrix interference in complex formulations, instrument sensitivity and calibration, regulatory compliance, and the evolving guidelines. These are the challenges in the impurity analysis for elemental impurities. Now see the compliance requirements for ICH Q3D. As per this ICH Q3D guideline, establishing permissible limits for each element is required, and it will be done through conducting thorough risk assessment, implementing validated analytical methods, ensuring continuous monitoring and quality control. Risk assessment strategies for compliance. So how the risk assessment will be done? It will be done through identification of potential impurity sources, evaluation of risk from raw materials and processes, development of mitigation strategies, regular review and updating the risk assessments. Whenever you are performing the risk assessment, ask the suppliers or vendors of raw materials and packaging materials to provide the declaration for impurities. How impurities or elemental impurities are being controlled by these vendors, and which type of impurities are likely to be present in their material. Based on that, you can do the risk assessment. I will be making a thorough and detailed video on the risk assessment of the elemental impurities in coming time. Now see the classes of elemental impurities. There are various type of impurities. These are toxic in nature, and these are having the different toxicity as per the different route of administration. So some are having high toxicity. So these are class 1 elemental impurities. Elements like ASCD, HG, require evaluation from all potential sources for all administration routes due to their established toxicity. Like lead is there, mercury is there. These are toxic elements. Class 2A, toxicity varies by route. So element like cobalt, nickel and vanadium require evaluation from all potential sources for all administration routes. Whenever you are performing risk assessment, these high toxicity elements are required to be thoroughly evaluated. Class 2B elements are various types, and these require evaluation only if these are intentionally added. So the toxicity of class 2B impurities varies by the route. Class 3 are those impurities which have low toxicity. Elements like barium, lithium, molybdenum, like these impurities, require evaluation for inhaled and potential parenteral routes for potential toxicity. But these are generally less toxic or having the low toxicity. These class 3 elements may not require consideration for oral routes unless these are intentionally added. Whenever you are working on the Q3D guideline compliance, that time understand the impurity classes, whether these are intentionally added and whether these are being detected in the material. Always have the declaration for impurity or elemental impurity in your hand provided by the vendors. Then you can do effective risk assessment, and you can have uh, the next plan, which may be testing plan or which may be the skipping for the testing of elemental impurities. If you come to know that there is no risk of elemental impurity in your product, then directly you can skip this testing and provide the justification based on risk assessment. Thank you for watching the video.